So let's talk about starting IVs. You're going to need some supplies. You'll need intradermal anesthetic if that is something you use in your facility, sterile normal saline flush syringe. You'll need an over-the-needle IV cannula. You'll need an IV start kit that should include a scrub of chlorhexidine, gluconate, or alcohol if they're allergic. You should also have a transparent adhesive dressing, some gauze, and tape in that kit or in the supplies that you gather to initiate the IV. You'll need an injection cap with or without the extension tubing. And before you start opening packages, be sure to perform hand hygiene and follow strict asepsis medical technique when opening those packages. Be sure and put the plastic side down just in case there's any liquids or spills, as this will help maintain the sterility of the packages and the contents of those packages. Moisture allows transportation for microbes through other materials. So you want to identify your patient, identify the vein. You want to get the patient's arm in a comfortable and easy accessible position, and you can assemble your supplies accordingly so that you create a smooth process when you are initiating the IV. So textbook is we start low, usually in the hand, and work towards the heart because that is the direction of blood flow in the venous system. So you don't want to poke a hole high and then poke a hole low, because now that higher hole can create a leak into those tissues. So now that you have the patient's arm in a comfortable position, you can start getting ready to actually start the IV. In the hospital setting, we like to use an intradermal anesthetic. This can be just normal saline or 1% lidocaine. It does create a little bee sting effect that lasts for about 2 seconds. And then you want to be sure and use good skin cleansing, 15 to 30 seconds, depending on the institution's policy. Tourniquet placement's ideal so that the ends do not flop over into your area that you're working. So once it has dried, that's when you can do your intradermal and or start your venipuncture to cannulate the vein. It does have alcohol in with the chlorhexidine gluconate, so it will burn if you poke it before that time has elapsed. And just remember to never put your fingers in the path of a sharp. And when you have the patient bring their fingers down, you want to pull skin traction. That helps stop the vein from being mobile, or AKA rolling. Intradermal is usually about 5 units if you're using an insulin or TB syringe. And then if you're using any other syringe that's in mils, you want to use like 0.1 mil of your anesthetic agent. And then just go through the little bleb that you created. That creates a nice little numb spot, so that initial discomfort is blunted. And when you have blood return, you may only have the tip of that needle in and not the actual catheter. And then sometimes you'll get up against a valve like this one. She had to back up before she could get blood return. And this particular IV is a blood control IV, so it has a special membrane that prevents the blood from dripping back out. You may not have that luxury in all places, and in that case, you'll want to apply pressure to the vein beyond the tip of that plastic catheter that's in the vein. Otherwise, you will have blood drip out everywhere. You may want to put a gauze underneath that IV hub. So the hub is the part that has the little butterfly wings. And again, once you scrub that site, you never touch it again. And then you want to apply your dressing. Nothing else goes on underneath the dressing. You can put whatever you want to on top of the dressing, as long as that insertion site remains visible, so that you're able to assess it and check for any problems that may occur in that location. And then you're going to finish securing the IV catheter and hub and any injection caps or injection tubing that you attach to it. Those end injection caps actually have a pressure valve inside, and it's considered a needleless system, so you never use needles on those hubs. It is a syringe luer lock only. So when you're removing an IV, people with fragile skin or sensitive skin, you want to actually push the skin away from the adhesive, and it hurts less and you're less likely to tear skin when you're removing that. You want to maintain and stabilize that insertion site, and then just remove it. You apply pressure after the catheter has left the vein, and you want to assess for hemostasis. Did it stop bleeding? Yes. And now you can apply tape to your gauze to secure that. And if you feel like you need to hold additional pressure, you can, especially if they're on blood thinners.